So tonight I want to talk to you about Republican plans to cut Medicaid. But first, let's talk about Medicaid. Now, if you get your health care through the Medicaid program, you know the importance of that program all too well. But what if you don't get your health care through Medicaid? What exactly is Medicaid? You might be familiar, of course, with Medicare that provides health care for seniors. But what about Medicaid? Medicaid is actually the largest health insurer in the country. In that sense, it's even bigger than Medicare. It covers 70 to 80 million Americans. It significantly covers children. So about 4 in every 10 children get their health care through Medicaid. About 1 out of every 6 adults gets their health care through Medicaid. A lot of people who are disabled get their health care through Medicaid. If you're getting long-term care, you're a senior and you're getting care at your home, or you're in a skilled nursing facility, there's a significant chance that eventually, if not from the beginning, you will get your health care through Medicaid. And the reason is that Medicaid predominantly serves lower and middle income families. So even if you start off as a middle income or a high income family and healthcare is expensive and you're a senior and you run out of resources and you deplete your resources, then you start getting your health care through Medicaid. Now, Medicaid goes by many names. In California, we call it Medi-Cal. It is funded in part by the states and it is funded in part by the federal government. Depending on the nature of how you get your Medicaid, it might be a 50% match, 50 state, 50 federal money, or it might be a 90% federal match, 10% state. But it is an extremely important source of health care for tens of millions of Americans. Now, let's say you're not on Medicaid. Why should you care about what happens to Medicaid? Well, because we're all part of the same healthcare system. Whether you're getting private insurance or Medicare or Medicaid, you're probably going to the same hospital. And if suddenly a huge portion of Medicaid funding is taken out of that hospital may close its doors. Already, particularly in rural parts of America, hospitals are shutting down. They just can't make ends meet. The reimbursement rates under programs like Medicaid are already so poor, a lot of doctors are saying, I'm just not going to take Medicaid patients. So if we take all that money out of the Medicaid system, a lot of hospitals are going to close, which means whether you're in Medicaid or you're not, your hospital may just close down. The same is true of healthcare clinics. Whether you're in Medicaid or not, you may be going to the same health clinic. If that clinic shuts down, it means you have to drive farther for that care. So we all have a stake in this. Anyone who needs to get to a hospital.
A hospital? What is it?
It's a big building with patients, but that's not important right now.
That's right. We're all going to face a circumstance sooner or later where we need to get to a hospital, and Medicaid is a big part of the reason why those hospitals are available to all of us, particularly to those who are lower income, but to all of us. So what's the threat right now to Medicaid? Well, the threat is this. The Republicans in the House have passed a bill which will require massive cuts to Medicaid. It will require potentially $880 billion to be taken out of Medicaid. So if that gets cut, that's going to result in all those closures. It's going to result in a deprivation of access to health care. It's going to mean that your parents or grandparents aren't going to get that care in their home. They're going to have to be institutionalized, and they may not have an institution to go to because that institution may close. It will be devastating. What's more, if the idea is, well, we're going to cut all these federal funds and then the states are going to make up the difference, let's face it, the states are not going to make up the difference. These services are going to be cut, and quite literally people are going to die as a result. Now, the president says, we're not going to cut services under Medicaid, and some of the Republicans are making the same noise. That's simply not true. There is no way to cut most, some, half of the funding for this program without massively curtailing healthcare access for millions and millions of people, and that will include you one way or another. Now, in the Senate, they passed a different budget bill, which doesn't set out how much they're going to cut from Medicaid. But they're going to come to agreement with the House eventually on a bill that's going to make massive cuts to that program. Now, why are they making cuts like this to Medicaid? Well, I will give you 2 answers. First, I will relate to an interaction I had with a constituent when we passed the Affordable Care Act. It was right after we voted on the Affordable Care Act, which has now become a quite popular program, but at the time was very controversial. It expanded healthcare access for tens of millions of Americans. And I was doing office hours in the Glendale Galleria, a mall in Glendale. I had my little card table set up, and I had a person come up to me and said, can I ask you a question? And I said, sure, that's why I'm here. How'd you vote on that Obamacare? How'd you vote on that Obamacare? Well, I could tell from the tone of his question that my answer was not going to be the right answer. And I said, well, I voted for it. And he said, okay, I will never, ever vote for you again. And I said, okay, I hear where you're coming from. It didn't seem like there was much point in engaging him. And he turned around to leave, and then he came back. And he said, can I ask you another question? I said, sure. What could you possibly have liked? What could you possibly have liked about that bill? And I said, well, actually, there was a lot I liked about that bill. I liked the fact that if you had a kid who was 26 or under, you could keep them on your insurance policy. I liked the fact that if you had a pre-existing condition, you could get health care. You couldn't be discriminated against in getting health care. I remember one constituent telling me, I am 65, I am a pre-existing condition. And then I said, I like the fact that tens of millions of people that otherwise can't afford to get health care are going to get health care. And what he said to me next really shocked me, because I'd had one of those town halls with thousands of screaming people talking about death squads and all the rest of it. I thought I'd heard everything until this interaction with a constituent. When I said, I like the fact that tens of millions of people who can't afford health care are going to get health care, he said, and you really think that's such a good idea? And I said, well, yes, I do. Don't you? And he said, no, I don't. If they can't afford it, they shouldn't have it. And I recognized the moment he said it that he was speaking for millions of people. That even at a screaming town hall were not going to tell me in such blunt terms that their view was, if you can't afford health care, no matter how hard you're working, too bad for you. That's your problem. But that's essentially what is driving this massive cut to Medicaid. It is an attitude here in the Congress. If you can't afford health care, that's too bad, that's your problem. It is being driven by something else as well. It is being driven by the need for Republicans to find the money to fund a massive tax cut for super wealthy people, because they can't do it otherwise. And so they're going to raid the till. They're going to take away people's health care from the disabled, from children, from women who are delivering. About 4 in every 10 women who are delivering getting that delivery care from Medicaid. They're going to take away long-term care from seniors, a lot of whom are veterans. They're going to take all that so that they can fund a tax cut for billionaires and large corporations. That's what's also driving this. But we are going to fight it. We are going to fight to make sure that Americans don't lose access to care, don't lose these vital services, and we need your help to fight it. Call your representatives, write to them, go to rallies, mobilize, do what is necessary. We are literally fighting for the health and well-being of our fellow citizens.